Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast. What's up, Everything Medicare Podcast Nation? However you may be listening and wherever you happen to be at this very exact moment, I hope you're doing well. Thank you so much for tuning in. If you do not know who I am, my name is Christian Brindle. I'm the host of this podcast where every single week I bring you 3 podcast episodes where we discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. And thank you so much for tuning in, folks. We are getting closer and closer to the end of the Medicare open enrollment period, but today is all about veterans benefits and Tricare for people that have served in the military and are veterans. Thank you so much to everybody that's listening that may be a veteran. Thank you for your service and happy Veterans Day. Today is all about you. Today is November 11th. This is episode 121, and this is about veterans. Every single year on Veterans Day, if the podcast schedule happens to coincide with Veterans Day, we try to do an episode all about that. If you didn't catch our episode, folks, that took place on Saturday, so 2 days ago from today, I encourage you to go back and listen to it. If speaking of veterans, I had on Joanna Wyckoff, who is a former member of the Air Force, a vet herself, and thank you for her service. And she's also a former Social Security employee. She worked for the Social Security Administration for nearly a decade as a claims specialist, and we had a really, really great conversation all about Social Security on the inside. Okay. And I thought it was an incredibly insightful, fantastic conversation that can really benefit anybody that has to deal with the Social Security Administration and people that are drawing off Social Security, if you're disabled and drawing off Social Security, if you're working on processing your Medicare enrollment. There's a lot of really good information on tips on, how to better work with them and kind of an explanation for why on the outside looking in, it might appear to be a little bit slower, if you will. Folks, I hope you had a fantastic weekend. I wanted to start this episode off with telling you a little bit of a story that's going on in my personal life right now. So, as many of you know, if you've been listening to this podcast since the beginning, we've been doing this podcast for about a year and a half now, 121 episodes in, and it's just kind of grown legs. We're now on about 15 to 20 different platforms with a very large audience. In the next couple of days, we should surpass over 20,000 downloads on this podcast. That doesn't include YouTube views and those kind of things. So thank you so much to everybody that's listening. So, as many of you know, though, that have been listening since the beginning, my wife and I had our first child earlier on in the year, back in May. We had a baby girl. She was 8.5 pounds. She's beautiful. Her name is Violet. Okay? Violet will be 6 months old this week. And it really, really makes you think. It makes you think that time really does fly by. It just seems like we just brought her home from the hospital. I know a lot of you listening that have, children who are, full-grown adults, and you have grandkids, and some people listening might have great-grandkids. You might be thinking about, oh, you have no idea, Christian. She's only 6 months. Wait till she's 16 and driving. I get it. I completely understand. But the point I'm trying to make is time really does fly. I was waiting this morning to get a haircut, okay, to kind of cut off all of my hair, if you will. And I was going through some old pictures of, well, I wouldn't even say they're old pictures, but I was going through pictures from when Violet was first born. I was looking at pictures when she was a newborn, pictures when she was a couple of months old, pictures when she was 3 months old. And the amount of change she's already gone through in her short life, how much bigger she is, how much more defined she is in her face, how much, more alert she looks in pictures, is remarkable to me. And it makes me realize, and it was something that I wanted to mention to you, that as a new father, it's something that I'm realizing very, very quickly, that every single person that I've ever talked to when they heard that we were having a baby, when my wife was pregnant, said, "Don't blink, it'll be gone before you know it." And I understood. It's not like I didn't listen to what they had to tell me, but I don't think you truly understand until you experience it yourself. I think you can understand the message, right? Even if you don't have a kid, you can understand the point, the message, but it doesn't truly sink in on how real and true of a statement it really is until you have a kid yourself and you experience it. I'm going somewhere with this. Time flies by in all areas of life, right? Like, I'm sure I'll blink, or it'll seem like a blink, and I'll be 20 years older, 30 years older, 40 years older, 50 years older. It happens to every single one of us. Father Time is undefeated as far as things just moving by much quicker than it feels like they are. And if you have anybody in your life that has served in the military, that's a veteran, that's put their lives, the short amount of time they have on this earth, in jeopardy almost, if you will, put themselves in risky situations, put themselves in harm's way, if you will, I encourage you to not wait, because today is the perfect day to tell them how much you appreciate them, number one, in your life, whether they're a friend or a family member, but number two, you appreciate the service they gave to this country. The reason that I can broadcast this episode right now and it reach 400 people, 500 people, 600 people, 700 people, maybe 1,000 people, however many people this broadcast will reach. And the reason why I can tell stories about my personal life, the reason we can talk about this is because we live in such a great country that's free. Is our country perfect? No, nothing is. But I'm a big fan of our country. And I am just so blessed. I feel so blessed and lucky to be here and for my daughter to grow up here to where she has the freedom of choice. And that's enough of me ranting about the holiday. Let's get right into this, okay? So today we're talking about veterans benefits and Tricare for Life. Okay, so we've done an episode, one of our earliest episodes when we first started doing this podcast was about Tricare, VA benefits, and federal plans. And it was named incorrectly for one, but we just had a typo and we just never fixed it. It was just kind of charming to me, a little bit humorous, kind of an inside joke for everybody that's worked on the podcast with me. But these things are things you need to be aware of, okay? And they work very differently. And for someone that's on Medicare that has VA benefits and or Tricare for Life, because people can have both, if they qualify, I should say, then you need to know how your Medicare will work with these things. My podcast episode we did back then is good information, but today I'm going to share some more in-depth information about these things. And both of them work quite a bit differently. So let's first talk about how they work if you just have A and B only and you leave it at that. So let's just, for the sake of example, say that we're dealing with two different situations, a person that has VA in Medicare and a person that has Tricare in Medicare. And then in the second segment, I'll talk about how it works if you have both. But let's just start with the basics here. Let's say someone has VA only and they have Medicare. Well, and this is going to be a little bit difficult to explain because the VA programs are not the same in all the 50 states, okay? I can tell you how they've worked in the markets that I've worked in. I'm licensed in 5 states, work with people in all different situations, but I have the most experience working with the VA department and the Veterans Administration here in my home state of Utah and a little bit in Florida. So the way that it works, and there's also different situations of VA, and we'll get into that in a second, but if someone has just, let's say, regular veterans benefits, typically speaking, they receive coverage and they're able to get almost free health care in a lot of situations, but they typically have to go into a VA hospital or a VA facility. It typically does not work unless they go into one of those veterans facilities. It wouldn't work, let's say, at a private hospital. Now you might say, well, Christian, doesn't Medicare pay some and VA pay afterward? No, not regular VA benefits. VA and Medicare in and itself are separate from each other. Medicare will cover the private facilities, the private hospitals, the private clinics, the private doctors, whereas the Veterans Administration has their own facilities that are designed and created to provide care to our veterans. And depending on who you talk to and depending on what state you might live in, depending on where you might be, wherever you might be listening to this from, some people think the VA administration is great and their facilities, some think they're not great. I can only tell you what they're like from my experience. So here in my home state of Utah, the Veterans Administration has doctors in training. Doctors have to have a certain amount of hours of training and experience before they can actually become doctors in and of itself. So typically they have to start out as nurse practitioners or as physician's assistants or something like that, and then they can kind of transition their way up. That's always been my understanding of the medical industry. I'm not in the medical industry, and I'm not a doctor, nor do I pretend to be one, so if I'm off on that, don't crucify me, but that's always been my understanding from people that I know in the medical industry. So typically, you're working with doctors in training. Okay, that's always been my understanding on the markets I work in. That might not be the case everywhere, but in my market, that's the way that it works. So, the quality of care is, depending on who you talk to, some people think it's great, some people don't. But the purpose of having Medicare for someone that has veterans benefits is they have the option of going to a private hospital if they want to. Maybe they're not satisfied with the care they get at the VA facility. Maybe they have a certain doctor they'd like to see. If they just have VA only, they're not going to have that choice because VA it's not like insurance, okay? It's almost like a membership that you're able to come into our facilities with your membership and you won't pay anything with our membership if you're part of our club. But it's not like insurance to where it's going to pay at different facilities. Now, there are different situations where it will, like, if someone is a veteran on veteran disability, at that point it kind of acts more like traditional insurance, or it can in some cases. It can reimburse them for certain things. There's different situations. There's also things like CHAMP VA. CHAMP VA, from my understanding, is coverage for somebody that is the spouse of a veteran. And with CHAMP VA, it works as actual insurance. It actually works similarly to a Medicare supplement, a Medigap, to where Medicare is the primary, pays 80% of the medical bills and whatever Medicare will pay for, and then CHAMP VA comes in as a secondary. But for just regular VA, people get Medicare because that way they have nothing to do with each other, if you will. Someone that has VA, veterans benefits, can go to the VA facilities in most areas, but not necessarily the private hospitals. It's not like insurance, unless, like I said, it's one of those other situations. So people get Medicare to have the option of going to the private hospitals just in case they feel like they might need the additional care. Tricare, on the other hand, is something that we're going to have to talk about in segment 2 because I have to take a break. Don't go anywhere. After a quick word from this week's sponsor, I'll be back and we'll talk about Tricare, and then we'll talk about what you should do with your Medicare if you have one or more of these two situations that you're dealing with. Don't go anywhere. I'll be right back. Happy Veterans Day.
What's up, everybody? This is actually Randy W. Hall, Mr. Nice Guy Medicare Advisor, not Christian Brindle, your esteemed host. I'm here to tell you about my Medicare agency, Mr. Nice Guy Medicare Advisor, based here in Tennessee. For the past 10 years, I've been helping Medicare beneficiaries just like you in Tennessee and Kentucky maximize their Medicare. If you're a regular listener of this podcast, you know Christian always encourages you to deal with a broker in your state who sells all the different plans and will give you not just a quote, but also advise you and educate you in a way that is simple to understand. We know how confusing and overwhelming the whole process can be. We do it all for folks on Medicare, from supplements to Advantage plans, Part D, cancer products, hospital indemnities, and more. So if you want to get a free quote or a consultation, I urge you to call 615-578-5174. Again, that's area code 615-578-5174. Or for more information, you can visit my website and read all about me at MrNiceGuyMedicareAdvisor.com. That's all one word, MrNiceGuyMedicareAdvisor.com. And again, why deal with a jerk when you can deal with a nice guy?
Welcome back, everybody! Hope you enjoyed that message from Randy W. Hall, the Mr. Nice Guy Medicare advisor. The enrollment period is still going on, and there's still time to save money on your Medicare plan if you live in the states of Tennessee or Kentucky, that is, because that's where Randy W. Hall, the Mr. Nice Guy Medicare advisor, does business with folks and works with people actively. I encourage you to give him a call. Let's get back into this. So we talked about in segment 1 how it works if you have Medicare and VA benefits, if you will. You know, almost like separate things. They really don't have much to do with each other. Tricare for Life is a different situation. Tricare for Life is something to where a person has their Medicare A and B as the primary insurance, right? Medicare A and B, we've talked on this podcast in excessive detail, nauseating detail, if you will, on what they cover and what they don't cover, okay? So we're not going to get into that too much, but in a nutshell, typically medical bills, right? Hospital stays, doctor's appointments, durable medical equipment, blood work, home health care, skilled nursing facilities, outpatient surgeries, yada, 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 right? We can go on and on and on. Tricare for Life pays as a secondary when someone has Medicare, okay? And it comes through and pays the 20% that Medicare doesn't pay for. Any deductibles that Medicare leaves behind, Tricare for Life pays them. Any co-insurances Medicare leaves behind, Tricare pays it. And then Tricare also provides other benefits as well, included like prescription coverage, things like that. Tricare for Life doesn't cost that person anything. Okay, it's not going to cost them a dime. So they pay their Medicare Part B premium, nothing for Part A, and they don't pay anything for Tricare for Life, okay? So typically when someone turns 65 and they have Tricare, Tricare requires them to get Medicare Parts A and B because they turn into a secondary, right? It's kind of a requirement, if you will. So a person like in that situation needs Medicare because Tricare for Life will pay at the private hospitals. It's actual insurance that's provided from the federal government. So what should a person on Medicare do with those specific situations? Well, here's my opinion. There's a couple different things you can do, and we'll start with Tricare for Life. You can take your A and your B and just leave it at that, right? You're going to have great coverage. You're not going to lose sleep at night. You're going to be in a situation where you will always have full coverage, but it's not to say it's the best coverage you can possibly get available to you. Let me explain. I always recommend people that have Tricare for Life consider, and there's very, very few people in the insurance industry that know how to do this and know how to deal with people that have Tricare for Life. So a lot of people, when I talk to that have Tricare for Life, they say, hey, I talked to 5 or 6 different insurance professionals. They always told me they couldn't help me. It's because they actually couldn't help you because they don't have the knowledge. It takes a lot of knowledge and a lot of expertise in this industry to know how to deal with this. I have a lot of clients that work with us that have Tricare for Life, a lot of people. And they're all incredibly happy and they benefit tremendously from working with us, and this is how they do it. Tricare for Life will not only coordinate with Medicare A and B, but it will also coordinate with a Medicare Advantage plan as the primary. So why would you want to pick up a Medicare Advantage plan? Well, typically with a Medicare Advantage plan, you're running your Medicare through a private insurance company. This Medicare Advantage plan takes the place of your Medicare, and they receive federal funding. Now, this only makes sense if you pick up an Advantage plan that has no premium. Do not pay a premium for an Advantage plan if you have Tricare for Life. Don't do it. You don't need the extra coverage, but if you can get the extra coverage without paying a cent for it and it works perfectly, why not? Now, there is one disadvantage to doing it this way. Medicare Advantage plans have networks of hospitals and doctors that require you to stay in network. The key is to find a plan that has a huge network locally that covers all your doctors and gives you tremendous amounts of choices in your area and will cover you fine when you're traveling and things like that. If you do that, you won't see any problems. Now, if you sign up for a Medicare Advantage plan and have Tricare for Life that has a real just itsy-bitsy tiny network, you're going to have problems with that. Don't do that, okay? Make sure that your plan has a big network, no premium, and good extra benefits. They exist in most markets, trust me on this. So you pick up this $0 premium Medicare Advantage plan. It comes through, it becomes your Medicare, right? Let's say it's through XYZ insurance company. They become your primary. Tricare for Life is the secondary. Between the two, you still have full medical coverage, so no changes there. But what are the perks of doing this Medicare Advantage plan, right? The coverage is full coverage either way. The perks are most Medicare Advantage plans come with a tremendous amount of extra benefits included. Silver sneakers, silver and fit, gym membership programs. There's a lot of Medicare Advantage plans that have $1,000 of dental benefits built right into the plan. Okay? There's $1,000 of dental you might not have before for comprehensive and preventative. Glasses coverage, hearing aid coverage, over-the-counter essential items. That I could go on and on and on. And Medicare Advantage plans actually cover more of a diversity of things on preventative care than original Medicare will, believe it or not. For example, original Medicare won't cover a physical after your first 12 months on Medicare. They will cover one in your first 12 months. They call it your Welcome to Medicare Physical. We did an episode about this earlier on in the year, but after that first 12 months, they will not cover a physical. Period. Point blank. They will cover something called a wellness visit, which is basically like a less detailed physical. They're not checking you well enough. Medicare is so silly. They're the only health insurance I've ever seen in my whole life that won't pay for a physical. I mean, most insurances take a look at it, and they determine that if they pay for a physical, they'll catch things early on, and they don't have to pay much as claims later. But Medicare doesn't get that. Medicare Advantage plans do. So there are some perks in that aspect. You get more preventative care than you would with original Medicare, okay? You get dental, vision, hearing in a lot of plans. Make sure that you have good benefits on that. And why not? You can get all these extra benefits that wouldn't work any differently than if you had original Medicare if it's done correctly. Now, there's a more complicated thing of this, though. A lot of times Medicare Advantage plans come with prescription drug coverage. But there's also Medicare Advantage plans that don't have the prescription drug coverage included. If you have Tricare for Life, you can get a plan with drug coverage or without drug coverage. It's your prerogative. The only difficulty will be if you pick up an Advantage plan that has prescription drug coverage, you're not going to be able to use Tricare for Life's mail order service, which is incredibly popular and many people like to use it. However, if you have the two drug coverages and you go to Walmart, let's say, to get your prescriptions, the two plans will coordinate benefits on the prescription coverage. We've done this for years. It works fine. It's just Tricare cannot do the mail order service if you have drug coverage through your Medicare Advantage plan because they can't provide mail order pharmacy services as a secondary prescription drug coverage. They can't do it, right? They have to be the primary and the only drug coverage to do that. So those are your two options. They can pay together on the medications, coordinate. I've heard people over the years, say that, if someone has Tricare for Life, they have to submit all their own claims on their own if they work with Medicare Advantage plan. It's false. It's phony baloney. Bullshit. Excuse my terminology. We've worked with so many people in so many different situations with Medicare Advantage plans. Never happened once. Not for anything. Not for prescriptions. Not for medical. Not for anything. So don't buy the fear-mongering. It's not true. It works beautifully if it's done correctly. So you have to know these things, though. You have to be educated on these things. Now, what about veterans benefits? Well, veterans benefits is real easy. If you have Medicare A and B only, to have, coverage at the private facilities that are around in your area, you are only covered by what Medicare covers, which Medicare A and B, like I said, has deductibles and co-insurances and things like that. But primarily speaking, for most things, you're looking at an 80% coverage range and you're left behind with 20% coverage of the bill. So the idea there is the same thing. Pick up a Medicare Advantage plan that's no premium. You'll have 10 times better medical coverage in most cases than what you'd have on Medicare A and B only. Okay, so if you did need to use it, your out-of-pocket would be much less. And you can also enjoy and benefit from the extra benefits, same as a person with Tricare for Life can. Although with VA, remember, they don't pay together. They're separate. Let's take a break, folks. I have some final thoughts on this topic. We will be back in segment 3. Don't go anywhere. Let's hear from our sponsor for this week. Welcome back, everybody, to our third of 3 segments on episode 121 of the Everything Medicare Podcast. My closing thoughts on this are this. To a lot of people in the insurance industry, Tricare for Life and VA benefits, more Tricare for Life, though, than VA benefits, are incredibly intimidating and scary for them to work with. If someone calls themselves a Medicare specialist and they don't know how to work with veterans benefits and Tricare for Life effectively to maximize your Medicare and give you all the benefits you can get, I mean, think about this, right? This is a no-brainer if you have Tricare for Life, in my opinion. You have the same coverage on if you didn't take the Medicare Advantage plan, but you can get a lot of extra perks and benefits. Just make sure that, 1, if you want to use the Tricare mail order pharmacy, they use Express Scripts for that, in most areas anyway, that you make sure that the Medicare Advantage plan you're signing up for doesn't have drug coverage, and you can continue to do that. Easy peasy. Number 2, has a big, large network of hospitals and doctors, so you have plenty and an abundance of choices on where you can go. And 3, covers your specific doctors, and 4, has awesome benefits. I mean, this is a no-brainer. If you can get all the same coverage that you'd get from original Medicare only, not have any difficulty, not have any headaches, and you can get dental, vision, hearing, gym membership programs, better preventative care, over-the-counter essential items, tons of stuff. And you don't have to pay a cent for it extra. Why wouldn't you do that? Why? It's vital, though, that you work with a good broker on this. There's very, very few brokers in the industry that actually know how to work with this stuff correctly to make it work well for you and you don't have any headaches. If this is not done correctly, it can be a mess. So be very careful with that. Folks, thanks so much for listening. The enrollment period rages on. We have till December 7th. If you live in the states of Utah, Texas, Idaho, Oregon, and Florida, again, that is Utah, Texas, Idaho, Oregon, and Florida, and you'd like to compare your Medicare health plan, whether you're turning 65 or whether you're already on Medicare and you're just not sure if you're on the best plan for you going into next year, my office is available to you. I really encourage you to give me a call, talk with me. Let's talk. My number to our office is 801-255-5340, 801-255-5340, and ask for Christian. We can compare your plan. We can see if there's a better fit available. And if there's not, at the very least we looked. And you can sleep better at night knowing you're in a great situation. Thank you so much for listening, folks. As always, if you're listening to us on a platform that allows it, please, if you found this episode beneficial and helpful for you, please leave us a 5-star review. It helps us reach more people just like you who need to hear this information. It helps the algorithms on the different platforms that the podcasts are played on. And it helps us reach more people just like you that need to hear this information desperately. Medicare is so complex for people. Medicare is so confusing, but it doesn't have to be if they have the right tools and the right information at their disposal. Again, happy Veterans Day, and thank you to all you veterans that served our country, and you were so brave. God bless you. Thank you for listening. God bless you, my audience, and I will be back with you on Wednesday. Have a great day!